talk about workplace health. This is a really fundamental point that unfortunately some of my public health colleagues are still getting their heads around. Some of the system still needs to understand. But if we're going to reduce the burden on health and social care for those people moving into older age, the time when we can turn that curve, as the previous speaker alluded to, is really between 40 and 60 at the absolute latest. Once they're getting over 60 towards retirement age, there's some things we can still do. It's never too late to get more active, and actually on that point, can I ask you all to stand up, because you've been sitting far too long. And you can sit down when you're ready to sit down or where you feel you're blocking someone's view. But it really is something that we need as a nation to get our heads around, that actually the focus on children's health, the focus on older people's health, but if we're talking about adults, we talk about the health of the adult population, employers and the workplace is fundamental to improving the health of this nation. It has, however, not a simple challenge. People are living longer, and that's the good news, and I'm going to come on to that a bit more. But they are living longer with ill health and more complex conditions. When I trained in general practice, which is some time ago now, 10 minutes was a reasonable amount of time because someone presented with one condition. Now, I'm married to a GP, I spend a lot of time with GPs. Most patients save up their issues because they've worked so hard to get an appointment. So they come with 3 or 4 issues, and you're desperately trying to get through them in 10 minutes. And trying to do good clinical medicine for multiple issues in a limited amount of time is really challenging. And as more of us live longer and we acquire more health issues, that challenge is only going to grow. In medical school, we're taught around tests of functionality, single tests about whether someone can comb their hair to test their shoulder and arm movement. We're taught about mental health assessments, questionnaires. They're individual tests testing an aspect of someone's functional attainment or regain after an injury or a health insult. But if you want to know how someone is coping on a global scale, then the single thing that you can do is ask about their employment status. Whether someone remains in work, returns to work, or is retained in work tells you more about how they are coping with their disease than any of those individual functional tests. And if we teach people differently to think about employment in this concept, that it is that functional assessment of someone's adjustment or adaptation to a health insult or a degenerative or fluctuating condition, then clinicians start to see work as a useful clinical outcome, as a useful clinical indicator. And that's the step change we're trying to move.